All right, we're going to go ahead and get started. Hello and welcome to the Spectrum Health Media Briefing. I'm Carrie Manders from Spectrum Health Marketing and Communications. Thank you for joining us today. Our panel this afternoon includes Tina Fries-Decker, Spectrum Health President and CEO, Dr. Daryl Elmucci, President of Spectrum Health West Michigan, Dr. Russ Lampin, Division Chief of our Infectious Disease Team, Dr. Mark McClellan, a Spectrum Health Pulmonary Medicine Physician, and Yvette Kamana, a nurse in our ICU unit at Butterworth Hospital located in downtown Grand Rapids. We will start this briefing with some opening remarks from Tina, our President and CEO, and then open it up to questions from the media. Please place your questions in the chat. We will call on you to ask your questions live, and we will answer them as time allows in the order in which they were asked. Tina, I'll turn it over to you to get us started this afternoon.
Thank you so much, Carrie, and thank you all for joining us today. Today marks the next chapter of our fight against COVID-19. The first vaccine was administered in the United States today, as well as here in the state of Michigan. Spectrum Health received our first shipment of the Pfizer vaccine shortly after 9 a.m. this morning. And we are proud to have administered our first vaccination just hours later at 12:04 p.m. Two of our team members who received one of those first doses are on this briefing with us today, Dr. Mark McClellan and Yvette Kamana. Following government guidelines, the first groups to receive the vaccine at Spectrum Health include those on the front lines of our hospitals, including the ICU, ER, and COVID-19 units. Spectrum Health anticipates receiving around 5,000 doses from Pfizer this week. We are scheduling people in phases to ensure that we can maintain consistent care for our community. And while we wait for the vaccine to be available to the general public this spring, we will work closely and collaborate with health departments, pharmacies, and other community partners. And we will work together to share ongoing education and information as we continue to learn more. This offers us great hope, but it's still really important that we practice what we know works to keep this virus from spreading. Thank you for joining us, and now I'll turn it over to Carrie to take your questions.
Thank you, Tina, for that. So just a reminder to folks, please type your name and media outlet in the chat, and then we will call on you for your questions. So please go ahead and start doing that. I don't see any questions in the chat quite yet. So why don't I just throw a question out there today? What was the anticipation like today as Spectrum Health was waiting for this first shipment of the vaccine? I don't know, Tina, if you want to take that question.
You know, the anticipation was momentous to see this happen for the first time. We're making history right now. And so as we all watch this occur, it's amazing. And like I said, it gives us such great hope to know what's coming forward in 2021. And we're also grateful to those that were the first ones to get this vaccine.
Great, thank you, Tina. Let's turn it over to Robin Erb for your question. Robin?
Hi, thanks for doing this. I'm with Bridge. Two questions, if you don't mind. If you could just give me a little bit of detail about the numbers of vaccines today and who got those first. And then also, will those be required of staff? And thank you.
Yeah, Daryl, do you want to take that question? And then we do have two team members who received the vaccine on the call as well.
Sure. So we received 975 doses in the first shipment, and recall that's how the Pfizer vaccine is actually shipped in those allocations. And we did not know when we would receive them today until late last night. And so today was a trial run where we actually vaccinated 5 of our team members, and the plan tomorrow is to open it up much more broadly. So tomorrow starts our true vaccine clinics that'll go throughout the week and weekend.
Thank you, Daryl. And
I'm sorry, would those be required?
Oh, I'm sorry. No. So we are very clear. This vaccine is so new, and while the science and data, which I'm sure our team members, including Dr. Lampin, can talk to, is so robust, at this point we are not requiring this of our team members, but rather strongly recommending.
Thanks so much.
So Jay Greene, let's go to your question. I think the first half might have been already answered, but the second part of your question, please. Jay, are you on?
Yeah, I'm sorry. Yeah, you mentioned 5,000 doses you expected from Pfizer this week, and you just mentioned that you've only dosed 5 people today. And when will you finish all 5,000 doses, and how's everybody feeling?
So I'll take that beginning part, and then I'm going to hand it over to Mark and Yvette for how you're feeling. But as far as our capacity, we can inoculate up to 6,000 of our team members per week. And if need be, we can scale that up even. So we hope to, once we get started tomorrow, rapidly accelerate the amount of vaccines we can give. And we anticipate getting through that 5,000 before next week.
And Mark, do you want to go ahead and answer, and then I'll turn it over to Yvette?
Yeah, sure. Thanks. So far, I feel fine. Not even a sore arm. It's been about 3.5 hours.
Same with me. I haven't experienced any soreness yet. I don't have any pain at the site. I don't have any side effects from the vaccine yet.
Thank you for that. Let's go over to David Bosick with Ludington Daily News. You can unmute your mic, David.
There you go. Sorry about that. When do you expect the vaccinations to reach some of your regional hospitals, such as here in Ludington?
And you might sense a theme that I'm a logistics person. And so I will tell you that by the end of the week, we will have some of our regional hospitals will have vaccine available. And then over the next 1 to 2 weeks, we expect all of them to have it available. Remember, particularly for this vaccine, the Pfizer vaccine, the main limitation has to do with its temperature and storage. And so there's a lot of logistical issues to work out, but we've been planning this for a long time. And ultimately, we plan on all of our hospitals having vaccine to distribute.
Thank you. Karen Usher from Cadillac News.
Hey, thanks for letting me ask a question. I was wondering how you chose the recipients that are speaking to us today. I mean, Yvette, do you especially love reporters?
I'm sorry, can you repeat the question?
I asked how the recipients that received the vaccine today were chosen, particularly given that you're here to speak with us today. And I joked, do you especially love reporters?
I don't like cameras, so I would say no. It was arranged that first responders, people who work mostly with COVID patients, would be the first people to get the vaccine. I work in the ICU exposed to COVID-19 patients. And so that's how we got picked first.
One of the things we did last week was we sent out a survey to all of our team members to understand from them who wanted to take the vaccine. And so now our teams are reviewing that. So we understand who is interested in it and who is not interested in taking the vaccine.
Yeah. Thank you, Tina. Let's go to Annie with Fox 17. It looks like you have a question for Dr. Lampin and Nurse Kamana.
Hi there. I don't know if you guys can hear me, but I just wanted to, I wrote it in there, sorry, preparing for our show, but Dr. Lampin and Nurse Kamana, how was getting the vaccine? How do you guys feel? I think you already touched on that, but why was being among the first so important to you?
So why don't we go to Mark, Dr. McClellan first. He was one of the first to get it.
Yeah, this is super exciting. That's the first word that comes to mind. I feel unbelievably grateful to have this opportunity to receive the vaccine. I know a tremendous amount of work and effort has gone into this for the last several months. And quite honestly, I feel hopeful. This is hopefully the start of the next chapter in this journey. And I'm looking forward to when this can get rolled out to everybody else in the community. Having cared for COVID patients all these past several months, I really look forward to this being widespread. And I'm very hopeful right now.
Great, thank you. It looks like we have another question from Derek Francis with Fox 17. Go ahead, Derek.
Hi guys, thanks a lot. Had to unmute there. Thanks, Carrie. Just kind of curious. I know this is all beginning and stuff, but there's so much information out there right now. You know, if someone's watching this, or maybe I can turn this to the newscast later, where does someone go to find out where they kind of fall on that pecking list? You know, that pecking order of, oh, I'm a first responder, or, and B, I mean, what should you tell someone to do when they want to get on that list to, hey, I know I can't get it tomorrow, but I would love to do my due diligence so I can get it when my criteria is up? How do people, you know, find out when they're up to get it and how do they get in line?
So I don't know, Daryl or Dr. Lampin, one of you want to take that?
I'm happy to. So internally, so for healthcare workers, it's pretty clear, and we're actually very transparent amongst our teams about the fact that, and you see folks here, the true frontline responders who are really key to critical infrastructure are being vaccinated. That becomes a little less clear when you start getting out into the outpatient clinics, but we've been working on trying to communicate that as well. And our hope really is that all of our caregivers and team members that are patient facing will be vaccinated, if we're lucky, with allocation within the next couple of weeks. Beyond that, obviously our sincere hope, and Mark said it very well, is we can't wait to start vaccinating community members. We can't wait to start hearing about the nursing homes where the residents and the staff are getting vaccinated. And at the end of the day, if you came in our hospitals and saw what Mark and Yvette are dealing with every day, you'll know that we want everyone to get vaccinated as soon as possible. And we'll be as transparent as we can with when and how, as soon as we know more from the CDC and from the state allocation.
Thank you, Daryl. Let's go to Stephen Gendel from CBS News.
Hi, thanks for taking the question. So I was told by some people who work with hospitals that there are some hospitals putting in extra security measures, just even kind of walking around the outside of the hospital, making sure the doors that are supposed to lock do lock on the outside, also making sure everyone who's coming to the hospital has an appointment that day and just kind of casing the joint. What are you all doing?
I will take this again, just given the logistics type question. So we are very mindful of security for the vaccine. Obviously, this is a precious resource. Actually, when it came shortly thereafter, Tina and I had a chance to tour the freezers and actually kind of held the first shipment. And quite honestly, it felt like a spiritual moment for me personally, just holding on to what really is hope for all of humanity. And we are very mindful of that. With that said, in this first round, it's only going to go to team members. We have adequate security around our freezers, are definitely in a secure location. And I think we live in such a good community that is so giving and caring. We don't anticipate any problems.
Great, let's head to Dan Gallo. I don't know if that's a question that you're asking to the—
Yeah, it is. Yeah, it is. Thank you, everybody. We've seen the video of the UPS trucks all over TV. We've seen the shipments. I'm just wondering if you could give us a little bit of the flavor of what the process was like on the hospital end. You know, do you get a tracking number like we do when we order a package, or what was that tracking process like once the vaccine was shipped out? And then I do have a follow-up question on regional distribution.
All right, I will take that one again too, because I was assigned logistics here. It literally felt like we were receiving a package from Amazon or Best Buy. In terms of last night, we received a UPS tracking number, and we knew when it was coming and how it was coming, and we met the UPS at the loading docks. And so legitimately, this could have been an Xbox for your kids, albeit much more important.
All right, thank you for that.
Can I ask one quick follow-up question on the regional distribution? On your list for the regional distribution, are there any more of like far-flung hospitals and rural areas? And if so, is there any extra logistics or difficulties in getting that vaccine to those types of hospitals?
So we very purposefully chose to allocate the 3 deep freezers we have, which are capable of holding about 70,000 doses per freezer, in disparate locations to make sure we had 1 in downtown Grand Rapids and 2 in more regional areas. And so those can serve as central hubs where we're able to distribute to other regional hospitals. So we have really complex and detailed plans surrounding all of that. And remember that with this Pfizer vaccine, you still can transport it and keep it outside of one of those freezers for a period of time as long as it's cold packed with dry ice. So we'll be able to get to all of our different areas. With that said, all of us are anticipating the Moderna vaccine being approved hopefully in the coming week or so, and that will obviously make it even easier to do that.
All right, let's head over to Daniella Silva from NBC News.
Hi, thanks so much for taking the question. This is Daniella Silva from NBC. Could Mark and Yvette describe a bit more what this experience has been like for them, and as some of the first people to receive the vaccine, what they want others across the country to know?
All right, Yvette, you want to go first?
This experience has been trying emotionally as a healthcare worker. You come to work not knowing what to expect. We've lost quite a lot of patients. And we see a lot of patients that are critically ill. So I have to say it's taken a toll on our emotions and our own physical being. It's very exciting, and I consider it a blessing to be one of the first people to get the vaccine, because this means we're getting somewhere. We're catching up on treating this virus that has made so much changes in our lives that we look forward to more people getting vaccinated. What I can tell people out there is that do your research, follow the science, and hopefully more people get vaccinated and we can get hold of this vaccine, this virus.
Thank you. Mark?
Yeah, I would agree with Yvette. Physically speaking, I feel totally fine at this point. I don't have any symptoms or side effects from the vaccine. Agree with Yvette. It's an emotional thing more than anything. I feel unbelievably fortunate that this is a reality now. I've been saying for months, when my patients ask me or my family asks me, that I'll happily roll up my sleeve and get the vaccine when it becomes available. And now that opportunity is here. I would echo what Yvette said. Read up on the studies. It's been very well scrutinized. Many thousands of patients in the studies. The FDA has recommended it as safe. And I would say talk to your doctor and encourage people. Certainly, I'm encouraging my family and friends to go out and get the vaccine. It's a wonderful opportunity.
Thank you. Let's go to Dustin Dwyer, who I think has a couple other questions for Mark and Yvette.
Yes, hello. I'm with Michigan Radio. I hope you can hear me. Just for Mark and Yvette, could you clarify which units and which hospitals you work in? And can you talk a little bit more about what you've seen most recently? We've seen the overall census numbers go down for Spectrum, but last I heard the ICU numbers had not gone down. How are things right now?
So Mark and Yvette, you want to talk about your specific units and where you work, and then Darryl can always take the overall number question as appropriate.
Yeah, thanks for that question. So I do pulmonary and critical care medicine. Most of what I'm doing right now is ICU medicine, taking care of patients in the intensive care unit with COVID, patients on ventilators, patients who are very sick. We have seen a fairly large, upsurge over the past couple of months. Most recently, just in the last, small number of days, the numbers have come down a little bit, which has been a good thing. Although they're still high overall. We've had to adjust and adapt. We've made our ICU space a lot bigger than it used to be. The ICU now fills a much bigger sort of footprint, if you will, than it used to. We've had to bring on other staff members, train nurses, physicians, and others who aren't historically ICU providers to help us out. It's a very team-based approach. I'm constantly inspired by my coworkers and my colleagues who have stepped up to the plate and done just a fantastic job at what is very hard work and very sometimes emotionally stressful work, taking care of these patients. So, that's kind of where we're at, and expect things to stay busy through the winter months. But everybody's rolled their sleeves up and is doing the right thing. And hopefully this vaccine will bring cause for hope and optimism in the coming months.
Is that anything else you want to add?
I think he covered all of it. We have an incredible support system here at Spectrum that even with increased patients and more ICU beds, we've managed to take good care of our patients.
Good, good. I think that answers that question. Why don't we go to Robin Erb for your question?
Hi, sorry about that. Can you hear me okay now? Here we
Yeah.
go. Thanks. Actually, my earlier question has been answered, so thank you for that. But if I could just follow up, when we're talking about the vaccine going into the general public, and I know we're talking about that's going to be a while yet, but can you talk me through like the decision-making processes? I don't know if you work with the public health department and they make decisions. Just talk me through that process when it gets to the general public.
So I'm happy to take that one. So there's a collaborative that exists that consists of all of the local hospital systems in West Michigan, all of the county health departments, and some of the large provider groups. And we've been meeting now at least weekly, actually more than weekly, for over a month. And all of that planning is going to place because at the end of the day, all of us have the same goal, which is to vaccinate as many people as we can once we get to the general public. And what we don't want to have is confusion about who should be vaccinating whom. So the goal will be, once the allocation comes, we'll all be able to say, I'll take this group, you'll take this group, and so forth. And to have unified messaging around that. So there's still a little work to be done, but it's gone incredibly well. And at the end of the day, collaboration is the key to make this work. And I'm so proud of everyone who's involved.
Thank you for that. Let's go to Whitney Burney from Wood TV. Your question might have been answered, but you might have another question, so we'll turn it to you.
Hi, I don't think it was all the way. I was going to ask if you could have someone talk a little bit about the critical timing of the vaccine. We've received it today. This is just a few, weeks and days after we start to see a surge, and as some healthcare professionals have started being concerned about another surge happening due to holiday gatherings. We've heard a lot from our governor about not gathering for Christmas. Additionally, we heard about not gathering for Thanksgiving. Can you have someone talk about how critical the timing is of getting this vaccine now?
Russ, I think this would be a good one for you.
Yeah, I think the vaccine clearly creates some light at the end of the tunnel, in the sense that we now know that we have an intervention that can be implemented that's going to end this pandemic. I think the potential irony here is that the vaccine is not going to have an immediate impact on community spread of COVID. And so while our healthcare workers are going to become protected, and maybe we'll have some ease of mind as they move forward about their own personal safety and about the safety of friends and family, that they know that they're not going to take COVID home. I think we're still looking at high rates of infection in the community, and we're going to be looking at high rates of hospitalization in the weeks moving forward. And so I think now if ever is a time that we need to continue to remain vigilant, that we need to continue to remain careful, to practice social distancing, to wear masks, to wash our hands, to stay home when we're sick. Because really, if we can get through these next few months, we really have an opportunity to really drive the infection rates down and to prevent any unnecessary hospitalizations and unfortunately unnecessary deaths as we move forward.
Thank you, Dr. Lampin. Stephen Gandel looks like you have another question from CBS News.
Hi, thanks again. And I think you answered this before saying that you're excited to eventually give the vaccine more widely in the community. But for the first dose or for all doses you get in 2020, is this just for your own hospital workers at this point?
So I'll jump because I saw your written question there as well. Just to be clear, the way this is working now in the state of Michigan is for nursing homes. Those should be done relatively soon and quickly, and that's via drugstores like CVS and Walgreens, that have national contracts. So we're ensuring that happens and really grateful for that. As far as what we're doing, it is primarily for those that work in the hospital, but actually our independent medical staff, so our physicians and other team members that work in clinical settings. You can imagine being in an urgent care where you take care of COVID patients coming in the door. We are ensuring that all of those folks are included in our initial allocation as well.
Thank you for that. Let's go to Justin Hicks with MLive.
Yeah, thank you for taking my question. This is for Dr. Fries-Decker. You mentioned a survey of staff. I'm curious if you know the makeup of those who do and don't feel comfortable. If you can kind of share maybe percentage or numbers wise on that. And then are you recommending staff who are pregnant avoid the vaccine or take it at this point?
So great question. And since we just sent out the survey, we're still getting responses back in because it went out on Friday, and we want to see not everybody within our team has responded to that survey. Just now we've received overwhelming response of yes. And so we can get that more information to you later. Daryl, do you want to comment on the pregnancy question?
Actually, I think it might even be best to have Dr. Lampin, who's our head of infectious disease.
Yeah, the question of the COVID vaccine and pregnancy is a little difficult to conclusively answer. So pregnant women were not included with the phase 3 trials for the Pfizer vaccine, and I don't believe they're going to be included in the Moderna trials either. But from a theoretical standpoint, there does not appear to be any reason why pregnant women would be in any danger from this vaccine, nor does there appear to be any reason for breastfeeding women or any concerns for the developing baby. And so I've been in communication with our obstetric service here and our high-risk maternal fetal medicine program here. And we've also been looking at national guidelines. We're still waiting on some maybe more formalized guidelines from the CDC and from ACIP. But I think the recommendation is going to come out that pregnant women who are in risk categories, so healthcare workers who are getting offered vaccination should receive it. And so, you know, they will obviously have the option. We're not mandating this vaccine, but we certainly are, I think, are going to offer it to pregnant women and to breastfeeding women if they are in an applicable group or a group that would be offered vaccination. Again, it doesn't appear that there's any significant risk or any risk at all. We do know, conversely, that women who are pregnant and develop COVID are at risk for greater complications. And so I think there's a real benefit to provide pregnant healthcare workers with some protection through this vaccine.
Thank you for that. Let's go to Dan Gallo with MSNBC. Not sure if your question was already answered, but go ahead.
Yeah, I'm sorry. That was, I think that was from earlier.
Okay, great. Let's go. And again, Karen Usher from Cadillac News, your question might have just been answered by Dr. Lampin. Anything else that you want to ask?
I'm wondering if you can extrapolate that out to the general public, if the advice is the same, or if that is specifically for people that are working in the healthcare industry and are particularly high risk. Sorry, I was asking about breastfeeding in pregnancy for those that are.
Yeah, I think, you know, as we get more experience with this vaccine, I think those recommendations for individuals and the general public, and we're talking again, pregnant women and women who are breastfeeding, will be more conclusive. Right now, we clearly know that healthcare workers are at increased risk of exposure. We also know that they're at an increased need to keep our infrastructure in place. And so I think the risk-benefit ratio for that changes. But looking at all the guidelines right now from the American College of Obstetrics and Gynecology, as well as from the CDC, there are not any significant concerns raised over giving pregnant women COVID vaccinations. So I would expect, knowing that pregnant women are at higher risk for complications from COVID, I would expect that the recommendation would be that all pregnant women who are interested in receiving vaccine will be offered vaccine. Again, that's out in the future, and we'll have more information, I think, even in the next few weeks as we see millions of healthcare workers get vaccinated. But if you were to ask me to venture a guess, I would say that it will be offered widely to pregnant women and breastfeeding women.
Thank you, Dr. Lampin. Emma from WZZM 13, I think your Tina just answered the question about the staff survey. Do you have another question you would like to ask?
Sure, I'll just ask, and I might have missed this earlier, I had issues with my Zoom, but do you know when the next shipment will be coming?
Sure, I'll take that. So the shipment that we received today was just the first of what we believe to be many this week. And so they're coming in kind of small amounts to different hospitals. So we hope to have a shipment as early as tomorrow and definitely by Wednesday. I'm still waiting for my UPS tracker to come to my email. And then obviously the good and the bad going forward is that we're told, and I believe this is nationwide, that if we receive a certain amount of shipments today, we're guaranteed that same number of shipments 3 weeks from now, because that has to be the second dose for both Mark and Yvette and everyone else. What we don't yet know is what our shipments will look like next week, and obviously a huge logistical puzzle for the federal government, but everyone seems to be doing a good job thus far.
All right, let's go to Mark Sanchez with MIBiz.
I'm curious on what do you have planned and what's in store on communicating to people the importance of receiving the vaccine. I think some of the polling data we've seen, the Pew Research information data a couple of weeks ago showed only about 60% of people said they would get the vaccine. And so what's planned to encourage people to get the vaccine? And how many people, what percentage of the population do you believe, based on your best understanding, that need to get vaccinated in order to get this under control?
Great. And Tina, did you want to take the communication, or would you like me to?
You know, I just say that we have a full plan to communicate about the vaccine, about the process, about how to go about it when it's available for the public. And so there's a lot of information that we're gathering, videos, interviews, discussions with our physicians, our nurses, our caregivers, as well as other people throughout our community who may be getting that vaccine when the time, when it's available to them. And so you'll see that come out in 2021 as we prepare for that. Daryl, would you like to comment on the population?
So this gets to the idea of how many of our general population need to have be vaccinated before we get to so-called herd immunity. Depending on which expert you listen to, you'll hear somewhat disparate answers. With that said, most people believe it probably has to be above 70% and potentially up to 80%, but definitely in that higher range number. And that's something that obviously over the course of the year, if there's enough vaccine, we really hope happens.
All right, Whitney with WOO-TV. I think you've got a clarifying question about administration of the vaccine. Go ahead.
Yes, hello again. I was wondering if you can have someone talk about the actual process of administering that vaccine. I spoke with our county health department earlier today, and they were kind of giving me a little bit of background on it, but I don't think a lot of people understand how a multi-dose vaccine works. Obviously, you just spoke about the fact that in 3 weeks, you're guaranteed another shipment. Can you talk a little bit about what that process looks like, and if that creates another logistical issue as we start to see more people being vaccinated down the line?
Sure, I can take that one again too. So for the Pfizer vaccine, remember every vaccine that ends up coming from a different manufacturer might have a different process. The Pfizer vaccine is a liquid that is deep frozen. It's about -70 degrees Celsius in a little vial. And that vial is a multi-dose vial, meaning it actually has 5 individual doses in it. Once you take that out of the deep freezer, it has to thaw for about 30 minutes, and you add a little what is called diluent, which is essentially sterile water, into that, and then you can draw off 5 separate doses. So it's just a way of a more concentrated for storage and shipment, but ultimately the reason we got to the number 5 today was we took 1 vial, ultimately diluted it, and so Yvette and Mark share something, not that there's any sharing of needles or anything like that, but they share that they had the same vial of vaccine administered to them. It's pretty straightforward, and it's not actually terribly complicated. The complex part is the cold, but once you have your processes down, that's not terribly hard to navigate as well.
And just to be clear, in 3 weeks, both Mark and Yvette will take another shot. Is there another one after that, or is just the 2?
For the Pfizer vaccine, it's 21 days after your initial dose, which is what the clinical trial studied. And so each of them has an appointment 3 weeks from today to get their follow-up dose.
Thank you, Dr. Elmucci. Karen Bouffard, I think you've got a follow-up question for Dr. Lampin.
Yes, hi, I just wanted you to clarify when you were saying that you think that eventually you'll be recommending that pregnant women who are at risk be vaccinated. You meant, I think, to say that that would be after the FDA issues guidance to that, in that regard?
Yeah, I mean, everything that I've seen coming out of ACIP, the Advisory Committee on Immunization Practices, so all of their preliminary data, as well as the statements that are coming out of different obstetrics and gynecology organizations, would indicate that it is safe for pregnant women to receive it. And so for our healthcare workers who are in risk categories that would recommend them receiving COVID vaccine, which really essentially would be all of our healthcare workers, they will have the opportunity to receive the COVID vaccine here.
Oh, even now before ACIP comes out with their guidance?
That guidance is, I mean, there will be a formal recommendation from them. I did have there was a conference that I was able to attend yesterday that did make that recommendation that for pregnant healthcare workers who are being offered vaccine, that they should have the opportunity to receive it.
All right, thank you for that. Let's go to David Bosick with Ludington Daily News again.
Hi, this is for Yvette and Mark, and you guys talked about the hope and whatnot that you felt as you're receiving the vaccine, but what was your initial thoughts and feelings before you got it? Nerves, butterflies, things like that. And when you were contacted just to say, hey, you are going to take this vaccine today, what were your initial thoughts then?
Go ahead, Mark.
Yeah, thank you. Honestly, I was excited. It's great to have this opportunity. Happens to be a day off for me, so it worked out well from that standpoint. But I've been more than ready to do this. Having seen what I've seen over the last several months, and having lived in this COVID world now, this is clearly the path forward and the answer. So yeah, I was ready to go, and I think, you know, as more and more people get the vaccine and see that things are good, I think people that initially maybe were a little bit reluctant or have been reluctant will probably warm to the idea, and you know, more and more people in the community will get vaccinated. So.
Thank you, Yvette. You want to share your thoughts?
When the whole vaccine research started, I was a little bit skeptical about it, and the more I read about the data coming out, the more they released more information and more data on how they were studying the vaccine, the more optimistic I became. We were not forced to get a vaccine, we volunteered. So we were one of the volunteers, and we were chosen to get the vaccine today. For me, it presents hope that we're getting somewhere with COVID-19. We've lost a lot of people. A lot of places are still closed. People are out of work. So if we can get vaccinated, develop some immunity, and maybe get some type of normalcy, for me, that presents me with hope that there's tomorrow or a couple of months from now, maybe a year, we'll have a good grip on this virus.
Great. Thank you for that. I think we're going to try to get in the last two questions here before we wrap up. So Karen Usher, I know you've got a follow-up question.
Yeah, from my boss. He wants to know what happens in between the doses if you start to develop antibodies after getting the first shot, or if you don't have any protection whatsoever until after you get your second.
Dr. Lampin, do you want to take that, or Daryl?
Yeah, I can take that. So there may actually be some protection that occurs after the first vaccination, although it takes about a week to begin to develop any antibodies. But that protection is really quite unreliable. And so when they look at the studies, when they look at it, there's a great graph. The New England Journal of Medicine published a summary of the trial, and it's in some of the early information that came out with the phase 3 data that went to the FDA as well, where you begin to see the placebo group and the vaccine group have a very similar curve with the number of infections that they received, or the number of infections that occurred in both those groups. And then at about day 14, the vaccine group just levels off, while the placebo group, the group of people without any vaccination, just continues to climb. By the end of the trial, there were 162 people in the placebo group that were infected compared to 8 in the vaccine trial. And they actually found that a handful of individuals developed infection that were part of the vaccine group in that first 3-week time period. So there certainly still is the possibility that you could develop a COVID infection after receiving the first dose. And even though there may be some protection in that window period, we know from the trial that after receiving a second booster, the protection is much higher, so 95% or greater, where the protection is far more variable in that window period from the first vaccine and the 3 weeks before you receive the second.
All right, thank you for that. I know, Robin, you've got a quick question about the process, and maybe we've already answered that question, but go ahead.
Little bit, and this is not terribly important, but I'm just intrigued by this whole idea that this very historical moment starts with like an email ping that says, hey, the shipment's on the way. Like so many of us are waiting for shipments right now. And I'm sorry, I'm not sure who received that email, but I'd love to hear more about that. Like, had you been checking your email? Was it expected? And what happened afterward?
So I'll take that. So we have had what's called a command center structure in place actually since the beginning of the pandemic, and it's been in place constantly. And so that is manned 24/7 by our expert team that manages the crisis with us. And the email went through that command center. So it's not like it came to our personal email box at home while we were shopping for our kids. It truly went to the appropriate parties. A number of us were then alerted last night, it's coming. So we were happy, obviously overnight with tracking, and I guarantee you signature was required. But it all went smoothly, and I give kudos to all the folks managing this, and UPS, which I'm told is the distributor on the east side of the country, did a remarkable job. It got here. We were told the 10:30 or earlier delivery. It got here well before that.
All right, let's go to the free press, and then we'll go to Wood TV8 for the last question. So is it Teresa with the free press? Go ahead.
Yes, thank you so much. Can you hear me okay?
Yes.
Oh, okay, excellent. Going forward, and if somebody else asked this question, I apologize that I didn't hear it, but we suspect that there's going to be hesitation by the public to take this. What can you say for those of you who've gotten it? What message can you give to those who may show a resistance, who are going to be skeptical or afraid? What message would you like to send to them about why this is important and why they shouldn't be afraid?
Mark, do you want to go ahead, and then Yvette? I think that's a good question.
Yeah, that's a great question. So I think probably my family was more nervous for me than I was, being the first. One thing that I kept in my mind the whole time was that, I'm really not the first. Many thousands have gone before me in the clinical trials, and that gave me great consolation. And this is really a blessing that this has become available to us so soon. It's the culmination of hard work by many people. Many of the most brilliant minds in science and medicine have been working on this. So I take great faith in that. The trials were very well done. It's been very well scrutinized, and it's clearly having lived in 2020 with COVID, this is clearly, we need a solution and a path forward. And in my mind, this very clearly is it. So I was more than ready to roll up my sleeve and get that vaccine.
Yvette.
Yeah, what I can tell the public is that I think with what we've experienced this past year, with so many deaths, so many sickly people, it's time for us to stand out for each other and help each other. Getting vaccinated is not just protecting me, it's protecting my family, protecting my patients who don't have COVID. And I think if you talk to your physicians, read up on the data that's out there, you can develop some trust in the science behind the vaccine. And the more we get vaccinated, we get more people to get vaccinated, the more we can get out there, get some people back to work, get things, restaurants opened, and children back to school.
Great. Let's take one last question from Whitney and then we will wrap up.
This one was for Mark. You kind of already answered it with Teresa's question, but I was just really harping on the fact that you were the first person in the state to take this vaccine. Can you just talk about how big of a deal that is specifically for West Michigan and what it says about medicine in West Michigan?
Good. Yeah, great question, Whitney. It's exciting. It's very emotional. There was a huge amount of emotion in that room at the time. That this is now a reality. I think it's just huge for society and humanity that this is now available. I think it's a great thing that here in West Michigan we gave the first dose. Spectrum's done a just unbelievable job of managing this and taking the lead at battling COVID, and so I felt very proud to be a part of it from day one. And so this is just a huge milestone in that journey, and I was humbled, truly humbled, to have been a part of it. And I look forward to honestly more and more people, getting this as a reality.
All right. Thank you, everybody. I'm now going to turn it back over to Tina, who can wrap us up this afternoon.
Thank you so much for joining us. As I said earlier, we are working closely and collaborating with health departments, pharmacies, other healthcare providers, and our community partners to make sure we develop education and give the public more information about the vaccine, and to do so in a way that doesn't create confusion, but helps everyone understand the value of this vaccine. And so you'll see that come out from us as we have, as this is more available to the general public. And we want to do so in a collaborative way, again, so we can support the benefit of this vaccine. I also want to take the time to thank Mark and Yvette for joining us today and sharing your experiences, and also for all that you do to care for the people who are in our hospitals every single day. We're grateful for you and many others like you serving our community. And to the people that have been working nonstop on the vaccine, on testing, it's just amazing what has happened in the last year. And I'm so grateful for the hard work of all of our team members at Spectrum Health throughout our state and throughout our country for what you're doing, because we do now have hope for 2021. Thank you so much for joining us.